You addressed childhood dementia earlier on. Can you talk about that? Because I think it's often ignored. It's like you mentioned earlier, early onset is becoming more common, but this
Kids?
unique area is
Juvenile?
not.
No way. Yeah. So juvenile dementia has been around for a long time. It sometimes is genetically linked, but sometimes it happens spontaneously. And one form is called Batten's disease. And then there are a lot of neurologic developmental genetic conditions that help people develop, cause people to develop dementia. And what happens is I develop sort of typically and normally right at first, and then all of a sudden there's a reversal. And so all of a sudden I have premature aging at 5 years old, at 12 years old, at 2 years old. Um, and a family, it's a mystery for a while and unless you have the genetic coding done ahead of time, you don't know what's going on. And I don't know, people may be younger on this channel and not know, back in the day, Rye syndrome, where young, particularly girls, if they got aspirin as children, started to develop brain change. And we found out, ooh, certain young individuals, females particularly, are at high risk of brain deterioration if we give them aspirin. So you don't give kids aspirin anymore. You give them Tylenol, you give them other things, but you don't give them aspirin because of, wow. And so we had kids that were developing typically normally, and then they became self abusive. They lost their language, they lost their mobility, they lost their finger skills, their eye skills, and became totally dependent and were often um, dependent for a substantial period of time through their 20s, early 30s, and they passed, or they didn't even live that long. So it's not prevalent, it's present. So families that experience it, Lewy body has a young onset genetic component. FTD does. Alzheimer's. There are people who are very young that can develop Alzheimer's. It's a very unique population, but it happens. So it's like, ow, imagine that. I mean, juvenile dementias, never anticipated, and yet part of the equation.